We're here with Malcolm Ball, who is one of Australia's leading developers in the gut health space. Hi, Mal.
Hi, how are you?
Great to be with you today. I wanted to ask you, now everybody in the world is talking about gut health. You have been in this space for so many decades. What actually triggered your interest in this gut health microbiome space?
Yeah, it's an interesting question. So I started off in the more traditional biopharmaceutical space, cytokines to treat things like MS and heart disease and that kind of thing. And through coincidence, I actually met my partner who was working in the food space. And at the time, a family member of mine had some serious issues with diabetes that he wasn't able to control with traditional pharmaceuticals, even though he was doing everything he was supposed to do. And we came across a food that could potentially help the diabetes space. And so it was my stepfather, and at the time, he had been a diabetic for about 35 years. And he had a heart attack because of his diabetes, and he was told if he didn't get his diabetes under control, he would die. And so I kind of went, well, we've got nothing to lose, and gave him this food, and his blood glucose went from 19 to 6 in the space of a couple of weeks.
So what was this miracle?
So the ingredient itself was based on sugarcane, but really what happened was we managed to regulate his digestive system and his microbiome, and that helped with his inflammation and his diabetes. And that was what sort of started the journey of getting into this space wholeheartedly. So I kind of changed disciplines at that point and moved into what is now called the food as medicine space. What we were doing was effectively treating food as if it was a medicine. So I was using my pharmaceutical background to look at foods, work out how people needed to eat, what it was actually doing. So we did PhDs, we did clinical trials, literally treated them like a medicine to show that what we were doing was modifying the microbiome. And we've since expanded into a lot of other ingredients, a lot of other foods to manage that gut health as a whole. And now, of course, everybody's understanding that really when you say the word gut health, what you actually mean is health. So, there's not gut health and health. If you have good gut health, you have good health. There's no way around it.
Why do you think that traditional sort of medical schools don't teach enough about this space?
So, traditional pharmaceuticals are exceptionally good at three things, and that's really what they were designed for. The first one is to protect us from an invader, so an antibiotic or a vaccine or an anti-serum, something like that. And the second thing is to fix something that is broken. Insulin for diabetes, for example, people with type 1 diabetes, they can't produce insulin. You give them insulin and they're okay. It works very well. Or the other one is to stop something from happening that shouldn't be happening. And then we're talking about things like cancer or, autoimmune diseases, those kind of things. And they do that very well. But it's really all they do well. And the problem that we have with the medical industry as a whole is they try and use them for everything. And because they work so well for that, there's this idea that everything should be treated with a drug. Everything is a problem that a pharmaceutical can fix. So it's not that they're trying to do the wrong thing. It's that the framework that they have is not correct. But fortunately, that's starting to change. I mean, there's a lot of doctors now that work with dietitians and nutritionists and things like that. And even the Diabetes Association of Australia recently has acknowledged that dietary management is the way to put people with type 2 diabetes into remission. So it is changing. But like everything, people take a long time to change their views. And quite rightly for the medical industry, we've got something that we think works or thought that it worked, and we're not going to change until you prove otherwise. Unfortunately, there's just a little bit of sort of emotional inertia, I guess, for want of a better word, tied into that as well. This is not my field, so I'm not going to I was taught how to use drugs, so I'm going to tell everybody to use drugs. It's kind of a, well, when all you've got is a hammer, every problem looks like a nail issue.
Initially, in our prior conversations, you mentioned there were some skeptical voices when you started off, and it was not an easy thing to battle those skeptical voices. Can you just tell us more about that?
Sure. I mean, part of the problem with sort of the food as medicine space or the gut health space is there is a lot of stuff out there that's just rubbish. And there's a lot of people who overclaim things and really say, we're going to solve all of your woes when you can't, and things like that. And so there was kind of this shell of negativity around the gut health space or just the food as medicine space in general. And when we first started, I mean, the word microbiome didn't exist when we first started. So, it was something that was invented by people around the time that we started looking into how these things work. So you're talking about an area where there really isn't enough general understanding for people to accept that it's real, or for doctors to accept it as real. And you have to understand that science is typically about 10 to 15 years ahead of medicine. So scientists know stuff a lot sooner than doctors know stuff. And that's right and proper, but it is also a big problem. So what you've got is a situation where there's a bunch of doctors, all they've seen is scammers. You come in saying, well, actually, we're not scammers. We've got scientific evidence to back this up. And their response is, well, you're just the same as everybody else. And that's really the kind of negativity that we associate. And we were called criminals. We were called scam artists. We were told we should be ashamed of ourselves and we're hurting people and all this kind of stuff. But interestingly, we went back to sort of the decade later version of the same conference. And a lot of those people came up to us and apologized and said, we were wrong. We realize now that gut health does manage a lot of these conditions, at the very least alleviates or reduces the severity of a lot of these conditions. And so that's really heartening because it has actually changed and it is actually changing. And now you can't go anywhere without hearing gut health, and that's as it should be.
You mentioned that there are lots of drug-induced conditions which can be alleviated with the correct food as medicine approaches. Can you expand on that?
Yeah, okay. So what we call lifestyle diseases, and I really don't like the term lifestyle disease. Calling something a lifestyle disease implies that it's something that somebody does on purpose, and that's not the case. I prefer the term societal diseases or environmental diseases. So diseases caused by the world that we live in, basically. So things like allergies and diabetes or type 2 diabetes at most, and certainly a lot of inflammatory conditions and immune conditions. What is happening is there's nothing actually wrong with our bodies. So this is an important way that you're going to look at these things. When something like type 1 diabetes where the body can't produce insulin, you have to replace the insulin. But with something like type 2 diabetes, there's nothing wrong with the body. It's just not working as efficiently as it should be working. And that comes down to our diet or our environment in general, which is mainly our diet. So you're talking about a situation where the body wants to do what it should be doing. It just doesn't have the tools that it needs to do those things. And that's where food as medicine comes in. Because what we're saying with food as medicine is we're not saying eat well. That's good advice. But what we're saying is we have identified that a person with this particular condition has this particular nutritional deficiency. And if they eat this food, it will address that deficiency, which means the body can then heal itself. So what you're trying to do with food as medicine is make the body work the way it wants to work anyway. But this is also why medications don't work very well in this kind of environment. Because if you give someone a medication, it still has to use everything else in your body for that medication to work. So in a situation, again, like insulin, well, the insulin's not there. But everything else is still there. So when you put the insulin in, the body has everything else it needs to work properly. And so the insulin works really well. But if you're in a situation where the body doesn't have what it needs to function normally anyway, giving somebody a drug to try and make it work normally, you're fighting uphill. You're not helping the body get where it wants to be. And you're in effect making it harder for the body because you're pushing it harder when it's already being pushed. And so you've got to work really hard to overcome that. With food as medicine, even if you have to take a medication, you should be using food as medicine as well, because then you're giving the body everything it needs for the medications to work better. And this is not theory anymore. We know this to be true. So vitamin B12 deficiency is very well understood to be a problem associated with diabetes, because the medications that people take for diabetes rely on B12 to work in the body, and so it gets depleted. And those medications work much better if you take B12 at the same time. So this is not theory anymore. This is well understood. Well, not well understood, but understood biochemistry. And the flip side of that is that a lot of these problems will just go away if you work out the right way to feed people. So really, a lot of what we think of disease is really just malnutrition. It's just very specific malnutrition that is presenting itself in a very specific way.
What was your pathway of developing a product, clinical trials? What advice would you give to a new developer in this space?
Yeah, that's a really good question. So there's a lot of negativity around anecdotal evidence, but the truth is that almost every scientific breakthrough starts as a story somewhere. So the first step is look at traditional medicines, look at old wives' tales, look at, different societies' natural therapies, because 90% of medicines, or 86% of all current pharmaceuticals, started off as natural therapies. 45%, something like that, are still considered to be natural therapies. So, for example, metformin, the most common drug used for diabetes in the world, comes from a flower. Well, it did originally. It's now synthesized, but it was originally came from the flower. And statins, who everybody knows treats cholesterol, they come from mushrooms. And so the reason why that they were turned into pharmaceuticals was because we didn't really understand how to get a mushroom that had statins in it every time. Okay. But the first step was still somebody ate a mushroom and the cholesterol went down. So that if you're trying to develop a new therapy, that's the first step. Have a look out there. Don't believe it necessarily, but search through it. And then you go, okay, let's do a test to see if this is real. Okay, we control an environment, we give people the food, we see if we see a change. If we don't see a change, why didn't we see a change? If we do see a change, why do we see a change? Then you've got to do what we call a dose response curve. So how much do you have to have? So when you take a traditional pharmaceutical, they know the range of doses that people have to take, and they will work on it. So one of the big mistakes that natural therapies make is they go, eat beetroot. That doesn't mean anything. Okay, yes, beetroot may solve the problem, but how much beetroot? How much beetroot do I have to eat? How much beetroot do you have to eat? Does any beetroot work, or does it have to be a specific type of beetroot? Does it have to be grown in a specific place? And these are all the kind of complexities that are associated with foods. So, and the reason why we made pharmaceuticals was really to eliminate those complexities, because if it's made in a lab, it's always the same. So if you're going to use a natural therapy, then you have to work out all of the different things that you need to control to make sure that it's always going to work. And that's a big problem, and it's a big error for people that are even trying to do the right thing. Once you know all of that kind of stuff, then you've got to work on how do you get people to take it. So what we call compliance is probably the biggest single problem in treating disease. Even when people know that it's going to help them, they won't do it if it's not easy and convenient. So you've got to work out how are you going to get the people to eat it? How are you going to make sure that they can eat it all the time when they need to? How are you going to make sure that their child can eat it? Is it the same for a child, or is it for the same for an adult? Yeah. So all of these kind of things. And this is what somebody goes through in the pharmaceutical industry as well. you've essentially got to treat the food as if it is a medicine. So what, how, why, which way, if that kind of makes sense. And that is not an easy process. And it's really important to understand that just because somebody found something that worked somewhere doesn't mean it's going to work for you where you are. So you can't, and like I said, that's one of the biggest flaws in the natural therapy is, oh, well, I will buy my licorice root from Slovakia. I'm making this stuff up now, obviously, just to be, because Slovakia has the cheapest licorice root in the world. But that doesn't mean that Slovakian licorice root treats the disease that Chinese licorice root does, or Indian licorice root does, or even Queensland licorice root compared to Victorian licorice root. You can't just make those assumptions. And this is where a lot of it falls down and why a lot of natural therapies get a lot of negative press. So it's both a justified criticism and an unjustified criticism. The justification is, well, you're not treating this as a medicine properly. The unjustified criticism is natural therapies don't work, when they clearly do.
And tell me something about your products. They're available in different shops, on different shelves. How does a developer end up with their product on the shelf?
Yeah. So that's almost as hard, or I'm sure my marketing partner would say harder than developing the product in the first place. So the Nutricane products are basically, they've been made to be drinks because we found that something that people can mix with water was the most common way that we could get people to take it, particularly people living with diabetes. A lot of their medication and regime is around food. So we tried to make it a food as much as possible. It's available online because we found that, a huge amount of resources are needed to have in-store things. But we partner with some vitamin stores. We partnered with some chemists. We're about to launch with various distributors. But getting it out there's a really hard thing to do. It's because there is a lot of stuff that just doesn't do anything. So it's a very busy industry. Certainly the most success that we've had and still the way that we prefer to do things is with healthcare professionals. So it's a lot easier to explain to a healthcare professional why they should be using Nutricane, how it can help, how it fits into what they're already doing, than it is to just kind of cold approach somebody and say, hey, don't do what you're doing now, do this, which is not what we're trying to say anyway. So it's really important to understand that these complex diseases are a combination of things. We're not trying to be adversarial and say, what you're doing is wrong. What you're trying to say is, if you do this as well, you will get a better result. And so you need to work with the people to do that. It's very difficult to do these kind of things in isolation, and it kind of should be. You know what I mean? I mean, somebody shouldn't be able to convince somebody to change their medical program easily. You want to do it properly. So that's the way that we've got it. So what typically happens is people are introduced to Nutricane through a healthcare professional, and then they come to us directly for buying it, or to a distributor or something like that. But yeah, it's not easy. And to be honest, I'm not sure we've cracked it properly yet either. It's something that we do okay. I think we could certainly do it a lot better.
So just to conclude, what is the next step for your company? Where is it going to develop further, and how does the future look like?
So we're very much interested in the kind of tree of diseases, if you like. So the way that we kind of look at it is that gut health is kind of the trunk of the tree. Gut health influences everything, but it's not necessarily the branches. So just very recently, we've launched 2 new products, one specifically for systemic inflammation, one for joint repair. And there are things that you need to repair your joints or your skin that aren't just gut health. Things like collagen, for example, to repair cartilage, and turmeric we use for its anti-inflammatory effect. Turmeric particularly has been shown to have an anti-inflammatory effect in joint tissue. It's very hard to get into joint tissue. And we're about to expand into the mental health space. So there's a huge amount of knowledge that's come out just recently about how much the gut affects our mental state, both cognition for things like dementia and the like, but also just for general feeling of well-being. I mean, I work with a healthcare professional who has shown in her practice that 80% of depression can be cured by changing diet. So, and again, the problem with these kind of just change your diet is it's incredibly hard. So what we're doing is putting together a Nutricane version that still relies on gut health as the base, but has other ingredients in it to meet nutritional needs for mental health. And we're also doing a lot more work with other people. So people who are saying, look, I've got this problem. Can you help us fix it? You know, where we go, well, okay, our understanding is that this is also a dietary issue and we can help a little bit with what we've got, but we're going to change what we've got to help. Can't really talk about that because a lot of that's confidential, but that's kind of the space that we're moving into. And allergies is an area that we think we can do help a lot. So we're very interested in that space as well.
Thank you very much for your time.
Thank you.